COVID-19 tests are supposed to be free, but our national investigative team found patients who received surprise bills weeks later. Here's Lee Zurich with our COVID-19 tracker.
A 3-minute COVID-19 test inside a parking garage that one person claims cost her nearly $2,500. Another social media post, someone says they were exposed to COVID at work. The screenshot of the bill, more than $1,000. Memphis resident Joe Sills got a $625 bill, over half his stimulus check.
What were your symptoms?
The symptoms were fever, I had a cough, I had shortness of breath.
Sills is uninsured. He went to a local hospital for a walk-up test in an outdoor tent.
Did they mention to you how much it was going to cost?
No.
3 weeks later, the bill arrived.
My reaction was I was pretty angry about it because I really thought that the test was going to be covered by the state.
Another social media post shows one person owes $741 for the COVID test, a test that returned a negative result.
In terms of a lot, I think we're starting to see there have been reports of people receiving bills for COVID tests and for very different amounts.
The CARES Act requires insurers to cover the cost of COVID-19 tests, but some patients are getting surprise bills.
We're also seeing cases where in hospitals they are ruling out other illnesses before they go to a coronavirus test, so they actually bill for all of the other tests first, and then get the coronavirus test. So there's multiple ways where the bills can go up.
Providers have a pool of federal money to cover the uninsured, but we found an uninsured comedian charged $230. Another person recently lost employer-based insurance and received a $1,300 bill.
If there's any question that you could get a surprise bill, that's going to deter some people from seeking the testing that they need for us to be able to get the pandemic under control.
This post from April might sum up the frustration with testing. 13 days after receiving a COVID-19 test, this person received a $214 bill. The bill came before the actual test results. Sills is also waiting to pay in hopes that the government will take care of his bill.
I'm going to wait until I get a phone call and find out. If I don't ever get a phone call, then I don't get one. But I'm afraid that I will get a letter one day from a collections agency over a bill that could have been paid. I just didn't know what to do.
Our national team reached out to that Memphis hospital. They said it's their intention that no one pays for a COVID test and will work with uninsured patients who received a bill. Up next on Valley News Live 10 at 10, another airline will need to ask you about your health before you fly.